Hi, I'm Nabeel, and today I'm going to talk about narrative medicine, the way to a satisfying healthcare experience. Over the years, I've visited numerous amounts of doctors, and I'm sure so have you. Some were good and some weren't. Now, the question that arises is how do we judge that? Well, it's quite simple. We judge them on the basis of how they interact with the patient and how they understand his or her problems. This is where narrative medicine comes in. The word narrative medicine arises three questions: why, what, and how. As in, what is narrative medicine, why is it necessary, and how should it be utilized? So let's quickly answer these. Firstly, what is narrative medicine? It is a medical approach that utilizes people's narratives, as in their feelings and experiences, to promote healing. In narrative medicine, doctors aim to deeply understand the emotions and experiences which are likely to have caused the patient's illness. In words of Dr. Venkiteswaran, bridging the divides that separate physicians from patients. Now to the second question, why? One of the main goals of narrative medicine is listening to the patient's stories, which ignites empathy in the doctor and in turn uplifts the quality of healthcare. In a study published by the academic medicine researchers in 2011 analyzed the effects of narrative medicine on 891 diabetic people, they found that patients of physicians with high empathy scores were more likely to have good control over their blood sugar levels, following which a study published by the Annals of Indian Academy of Neurology in 2011 determined that people with migraines were more likely to stick to their management plans when they felt that physicians were more empathetic to their condition. Now to the last question, how? Well, there are several ways that may start the conversation, like how do you feel, what do you think is going on, and what problems is it causing you? Well, sometimes the doctor isn't familiar with the practice of narrative medicine, so it is your responsibility to optimize your standard of healthcare by starting the conversation yourself. Well, now that we have answered all the three questions, here are some tips to ensure a satisfying healthcare experience. Firstly, try to narrate your problems in the form of a story. It helps to create more empathy. Then, if you're suffering from social anxiety, try to get someone to accompany you, like a friend or a family member. Third, your family's health history is very important. Fourth, if you're shy about sharing your personal problems with the doctor, remember, doctors are used to discussing personal problems. And lastly, if your doctor doesn't approve narrative medicine, try finding the one that does. Thank you.